show for us on this model exactly what we were treating, and do we have the ability to zoom in to this model?
That camera. Oh, there you go.
There we go.
Great.
So this is a plastic model that we're going to use to show you exactly what the pathology was.
This yellow thing is the cholesterol plaque.
So that's demonstrating the inside of an artery, correct?
Yes. And this is our wire over here, and there's a stent on top that when we expand, it gets delivered just like this, and it opens up the artery.
Okay, so that the model on the top on the right shows us that it's a clogged artery, correct? There's a clot
Yes.
in the artery.
Yes.
And then and those are blood cells that are falling down in there, right?
Yes.
So
Yes.
go back to the model at the bottom and go through it with us a little bit slower. So I
let
think
me go
one more
back. Let me
turn, one more
finish.
turn,
Yeah.
right?
So this is where the cholesterol is.
So inside, you're looking inside a cut open
Inside,
artery,
that's
and the
right.
yellow stuff is a cholesterol plaque that's
Plaque.
blocking the flow of the artery.
Yes.
It's like stepping on a hose in your driveway. The water's not going to flow through,
So
right?
there are two kinds of chest pain. One is called stable angina. When they exert themselves, not enough blood flows, they start getting tightness and heaviness in the chest. And
Let's stay zoomed in on that if we can for a little bit longer. Thanks,
then
man.
we can put a wire through there and then stent it, and boom,
So that's two steps. The first step is to put a wire in there, and you can show us one of these wires in a second. In fact, stay zoomed in, and he's going to show us a real wire that's used.
this is what we call a
Hold
catheter.
it closer to here so it
Yeah.
stays in focus. And
It's
so,
shaped like this depending on which artery we have to engage.
now it goes in unbent like that, of course. The bend in is to help us turn corners and everything, correct? And so this will go inside the artery through the wrist or through the groin,
Through the
right?
wrist
Through
or
the
the
vein.
groin, yes.
And then you track that up into the heart and then into the arteries that supply blood to the heart.
And there's
Right.
a camera on this too, right?
No, there's no camera. All we do
camera?
is we inject contrast,
Uh-huh.
and then we have a camera here and here that takes pictures.
Right, and so what contrast is a material that shows up on the X-ray machine.
On the X-ray.
And on that
It's
video
opaque.
that we saw, you saw this machine above and below the person.
Yes.
And that's a fluoroscopy machine.
Exactly.
That will actually show real live moving picture X-rays of the actual catheterization. And so you can see the blockage and you can see dye injecting. So you'll inject the dye won't flow past the plaque, correct?
Exactly, that's exactly right.
And so you identify where the plaque is, and then you talk to us about, you said the word stent. So after you've identified the plaque, define for us what you mean by stent and how you make the plaque go away and the blood flow go through the artery so that the heart gets the oxygen it needs.
So this is a picture of the stent. It's made of a wire, and there's a lot of technology and experience involved in making these stents.
Could you zoom in again, and so can you hold the stent close? Oh, I understand. So can you, why don't you come around and show the stent against the model that you have here? Are you able to zoom in on this plastic model? All right. Okay, Doc. So I'm giving you a little bit of a white background here. Can you show us the size of these stents and wires that you use relative to this?
So this is the stent, and this is the actual dimension of the heart,
So that's a life-size heart.
life-size heart. These are the arteries, the red ones, the blue ones are the veins, and the arteries get clogged up, heart doesn't get blood supply, they either have a STEMI or blocked arteries suddenly, and in this case, the patient would have stable angina. They exert and they get tightness, heaviness, shortness of breath.
Pain with exercise.
Pain with that's called stable angina. And so this is the actual wire that we use. This is a run-through wire.
And
It's
show
very
us in
fine.
front, show us next to the heart because you're off camera right now. Yeah. Okay, so that's an actual wire.
It's an actual wire.
That will be placed into the beginning of the artery as it supplies blood flow to the heart.
That's right.
And you'll be able to follow the whole thing because the dye is in there.
It's going to show us which way to go. Is
And
it
there's an-
turned? Is it straight? Is it curved? You know,
And so
there's-
inside the catheter that's inside the vein, now, yeah, show us sideways. Show us your hands blocking it.
so essentially we come from.
Don't use your other hand there.
You're blocking the camera, doctor.
Oh, oops.
Yeah.
This doctor is no good then, huh?
He's not a good teacher right
You're
now.
good where it
So
matters,
let's
when
turn
it
it-
matters.
You're infinitely better in the operating room than you are in the TV set. So again, let me show. The catheter, and are you ready to thread it through? Don't do it yet. The catheter, so this goes into the vein, and then
Goes into the artery.
Okay, goes into the arm, I'm sorry. And now show us threading it. So this blue catheter, you can't see it as blue perhaps on the TV, and there's a catheter that actually goes in. Okay, do you see that? And so the first catheter takes you to the artery.
To the artery.
And then what is this flexible wire doing that you just put through the catheter? Explain to us what
These
this
are
is
the
doing.
wires so that I can look at them on the fluoroscopy machine.
Uh-huh. And
And
what
I
does
can-
that teach you?
It tells me if I'm going the right way because not all arteries are straight. Some
Gotcha.
go like this, like this, like this.
And so that helps direct you.
So I can, and then we have what we call a torquer here. There's a small device that I can and rotate this, and I can rotate the tip, and I can make it go 90 degrees this way, 90 degrees
So you
this
can really
way.
steer this object.
Steer it, yes.
Anywhere you need to go, because the arteries do not follow a predictable pathway, and you can follow them, correct?
Yes,
All right. And then that can take you right up to the blockage.
Right up to the blockage. Some
then-
blockages are easy to cross, like the STEMI blockages are easy to cross because, as I showed you over here, there's cholesterol plaque. These are called the shoulders.
Uh-huh.
The
And so-
plaque ruptures, secretes a chemical, and clots form right there. And that's what happens when you have a heart attack.
Tell us what happens with a stent.
So what the stent does is it's like a scaffolding that keeps the artery open.
So it's a tube.
It's a tube, yeah.
All right. Do you have one of those with you by any chance?
Let me see.
Yeah. So basically, if the artery is hurt inside the tube, we can put another tube inside of that that's made out of a man-made material, and that holds the artery open so that the patient's blood flow will go through the artery and bypass the plaque or the damaged wall of the artery. Did I get that right?
Yes.
Okay.
So when I trained, we didn't have stents. We had just balloon angioplasty. It goes and just makes some space with the balloon.
Which means that you go into the area that's squeezed, blow up the balloon, and you expand it.
And all it does is squeezes the cholesterol to the side of the wall, but it worked. You know?
But it worked.
But the problem is that it caused damage and it can close again, so we had to take the patients back to the cath lab. It could take
It
up
was
to
a temporary fix.
It could take up to 6 hours to do one case. When I was training at Greenville, I would go every day at 4 o'clock in the afternoon and work till midnight to do 1 or 2 cases.
Right. And so now we don't use the balloon, the
We
process.
just the balloon we don't use. We mostly put in stents because then they don't close up and then we don't have to go
Because
back
it's a
in the lab.
rigid-walled
Yes,
piece of
yes.
man-made material that cannot get blocked.
Mm-hmm.
And they've been around a long time, so people can feel pretty comfortable that they
Oh,
really
the
stood-
stents have been there since 2000. I know for sure because when I came here in '94, there were no stents. So I had to go to Duke to learn how to deploy stents. It's just times have changed so much.
And is it pretty much permanent, or do people
Once we
have
put it in, we cannot take them out.
to? Okay.
Nor do you want them taken out.
No, we
right?
don't want them.
Yeah.
I thought it was really interesting that that patient, though, immediately he was able to tell you that he
Yes,
felt so much
yes,
better.
Yeah.